most of the time, 80% of a person's issues, symptoms, whatever else, will dissipate and go away if they correct their environment. We can't out-supplement nor out-drug a bad environment.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome back to episode number 60 of the Healthy Skin Show. In today's episode, I'm going to be sitting down with a functional medicine expert and friend of mine, Dr. Jerry Bailey, who will be discussing with us the stress response in conjunction with skin rashes. But first, I just want to give a shout out to DIY Dietitian for leaving such an awesome review of the show over on iTunes, sharing that she loves the quality of the skin experts on the show and diversity of topics. Each episode is in a bite-sized piece so that it's easy to take in and complete. Such an underserved area that Jen is providing content for and always touches on the emotional aspect as well. Thank you so much for leaving that awesome review of the show. And yes, it is a bit more on the bite-sized side of things. And that is intentional because I know that you guys are busy. There's a lot of moms who listen, a lot of dads, a lot of just busy people in general. And a half hour seems to be the sweet spot. I do my best to honor that so that I'm not getting into the weeds or talking to somebody about what they had for lunch and discussing trivial matters that don't really matter to you. If you've been a fan of the show, you've been tuning into every single episode, and maybe there's even an episode that was your absolute favorite that you shared with a bunch of people, but you haven't yet rated and reviewed the podcast. Please take a moment, head to your podcast platform of choice, rate the show, and if you can, leave a review. Share why you love the show. Believe it or not, that one small action does mean a ton, especially for those who are looking for a reason why they should give the show a chance. And you never know, your review may be the reason that someone finds answers that they've never gotten before. Since Dr. Jerry and I talked for quite a while, I want to dive right into today's conversation. Hi, everybody. Welcome back to the Healthy Skin Show. Today, I have a very special, funny, hilarious, amazing guest with me who I'm excited to introduce you to. His name is Dr. Jerry Bailey, and he is a guy's guy, a very funny guy's guy. And he also happens to be a chiropractor, acupuncturist, and functional medicine doctor. He's a dad to 2 boys and practices functional medicine, along with being the host of the insanely funny and popular show, The Guy Show, where he interviews experts offering their best tips, tricks, and tutelage in health, wealth, and mindset for guys. His irreverent look at life, health, and mindset allows guys to talk about the things that matter most to them while keeping it real, yet approachable, allowing men who listen a very humorous but serious talk on the topics that affect men in the midlife. Dr. Jerry, thank you so much for joining us.
Oh, I'm stoked to be here.
Well, I'm excited to have you here because, I've been on your show, and I'm excited for that episode to share that with everyone. But then also we were talking before we started recording this about how most of the content that I talk about is mostly geared toward women. Then we have moms listening, and we have men listening, and dads listening who also struggle with skin issues. But I think what's really interesting about you is that you're looking at things from the perspective of men and the masculine side of the equation, which I think is very important and oftentimes gets overlooked because men do suffer with skin issues. And so I'm really actually grateful that you were willing to be here to talk about the way that you address skin issues in your practice. So that said, what do you feel like is the biggest piece to the skin equation? I mean, I think, you can certainly share where you feel like this is a universal thing across the board and when it's maybe a little bit more applicable to men and the guys that are listening. But where do you think the biggest piece of the puzzle with dermatologic issues lies that is often overlooked in conventional medicine?
Oh, I think it's definitely has to go with at least looking at GI function and any kind of dysbiosis that could be occurring within the GI tract. When there's skin stuff, when there's, not a known irritant that's causing skin damage, from the external environment, we have to look internal and go, what is going on internally that's causing this autoimmune type reaction or deposition of antigen antibody into the dermal layers from internally that are causing these problems. So, and that's, not just for guys, but for women, for kids across the board. We have to see what is causing those reactions in the body and figuring that out. So I think that's really the biggest thing, is finding out what, that underlying why.
And so with that said, I want to back up a tad, because you're literally the first person to mention that phrase, antigen, antibody, whatever that was that you said.
Combination. Combination.
Yes. So for somebody who's listening to that and they're like, wait, what are we talking about?
Yeah.
Can you break that down a little bit so that they can actually, maybe at least imagine what's happening or what that is in terms of the layman?
Yeah. So it's looking at basically an immune complex formation. You have an antigen, which is a presentation from a bacteria, a parasite, something in the system that does not belong there. And the body goes, hey, that doesn't belong there. It activates maybe a B lymphocyte or something else to create an antibody against that antigen. It tags it with that antibody, and then the rest of the immune system can hopefully clear it out of the system. And so it's basically a combination of a marker from a cell, from a bacterium or something else, and then the antibody to go along with it that attach to each other, kind of lock and key, and then that activates the immune system to say, attack this and kill it. So if those get overabundant because there's an overgrowth of something, particularly in the GI tract, could be on the skin also, then that creates this large amount and it has to go somewhere. It has to be deposited. And if I bring in a little woo-woo, but not too woo-woo, Chinese medicine aspect there, we like to see skin stuff because then we know something's going on internal. If we don't see skin stuff, we're not sure where it is. So when we see that antigen antibody immune complex combination start depositing in the skin and then show eruption within the skin, through eczema or dermatitis of some sort or any of the other conditions there, we can actually then we know something's going on internally and we know how to address it.
So again, first person to say this, from a Chinese medicine perspective, you are looking at things, connecting what's happening on the skin with something internal. So if someone is looking at it from this Chinese medicine perspective, right there, that shift has to say, you cannot just look at things being on the surface. We've got to look deeper.
We have to look deeper. If we're just, again, depending on the case, if we know there's a known, poison ivy, say, or poison oak, or a rash from a soap that wasn't used, when we know there's a contact dermatitis, so it's been exposed to something on the external environment, then we know, okay, that's the root cause there. But when we don't have that known thing, we have to go, well, why is this occurring? And where is the underlying issue that's bringing that, quote unquote, to the surface? Making that volcano erupt and showing a dermatological reaction there. And so within Chinese medicine and then within functional medicine too, it's always that deep dive into why and where things are coming from. And most of the time it's GI related, gastrointestinal related.
Yeah, and we've talked a lot about like the gut stuff, but here's the question for you. Because this is a little bit of a shift. Now we're really focusing in on this antigen antibody complex. If this whole cascade, we'll say, of an immune response is happening, and someone is saying, okay, how do I, A, know if I have this going on, and then B, how do I even stop it?
Right. So how do you know what's going on? Well, there's some simple testing that can be done to see, particularly if they have GI symptoms. Now, if you don't have GI symptoms, it doesn't mean you don't have issues there. You're just lucky. And that's a small percentage of what I see. Really, of all the people that come in with issues, 10% don't have GI symptoms, and then the rest of the 90% do. But that 10% typically have gut issues also, where they're just not presenting as a factor in their symptomology yet. So in looking at that, as we're kind of digging deep into history with a person, what's going on, we can look at running a particular test that I like, which is a stool test, which is a PCR test. It's called the GI map. There's also several other ones out there that do the same thing. It looks for DNA. And as long as it finds DNA, then it can quantify how much of that bacterium, parasite, mold, yeast, fungi, worm is in that GI tract that could be causing a systemic problem in the person.
And so if that is the case and somebody has, let's just say, for example, they've got some fungal organisms living in the gut.
Mm-hmm.
If you are to clean up the gut, would that, and I'm asking this from the perspective of, because I know the answer, but I want to ask this perspective from the person who's listening, who's like, wait, I'm not too familiar with this. So if they clean up that issue, will it halt the reaction, or does it at least help quell that antibody antigen complex immune cascade that's going on?
Both. It'll quell it down, but it can also fix it so it doesn't happen. And so we know that dermatological reaction then is a result of that gut infection that's causing the problem, causing the immune complex, causing the deposition in the skin. So we know that cascade occurs. So yes, it will fix it, or B, it will quell it down. And sometimes what happens is if it's fixed, it's typically fixed. But sometimes if their system is not quite strong enough and their bacteria is not quite strong enough in their GI tract to hold things off, they may require longer-term probiotic care or something else to keep that at bay so it doesn't rear its ugly head.
And from a Chinese perspective, when you look at rashes and how, or maybe where, that's the right question, where they present, do you ever use like anything as far as like the meridians to kind of say, okay, there's on this meridian, like, is there any connection between where rashes present and maybe different, is it organ systems in Chinese medicine?
So, yes and no, because the meridians flow from where, they're named for where they go through or come from. And so in the process of naming them, they became kind of an organ-based thing. So, it depends on what's going on with the person that we can say, okay, this meridian's involved. But really, because the dermis is such a large organ, and, it's not going to typically follow a nerve track in this sense, if we're looking more at a shingles type presentation, then we can say, there's not necessarily a meridian system involved in the dermatological presentation of their issue.
Fair enough. I always was curious about that. My sister's an acupuncturist, and it was always something that I wondered. And I've actually been asked a number of times about like facial diagnosis. Like if you have a rash on the face, does it follow the different, there's facial mapping for, I believe, Chinese medicine and Ayurveda. And I was always kind of curious to know that, whether there was any connection between the two. But some people have rashes everywhere. And then it's like, well, I don't know. It's affecting everything. So aside too from the gut, is there a next area that you might say, all right, so we've got the gut. We know there's an issue with the gut. What would be the next spot for you in your experience with clients? Where would you look as well? Because I oftentimes find that it's not usually just the gut. Like there's other components here that have to be looked at. And especially too, if there's anything specific to men, obviously, we would love to know.
Yeah. I think there's two parts there that we can answer. Is one, we're going to look at globally. We're going to look at, okay, what's the next step? Liver. Is the liver able to detoxify, clean out these immune complexes, and get them out of the system? So if that's a backup in any way, then we're going to see backup causing through that process too. And so liver is kind of number two. And then that third one is hormonal. I mean, it is, and it's for guys. We're looking at testosterone. We're also potentially looking at estrogen being an issue of it too, if there's an overproduction of estrogen in the system, which I'm seeing a ton of in guys now. We're seeing an overdominance of estrogen, so almost an estrogen dominance like women have in their system. I'm seeing the same thing in men from teenage years, at pubertal years, on up to the elderly guys. We're seeing lower testosterone levels and increased estrogen, which can increase acne. But also, if we potentially have a higher testosterone level, that tends to happen in the pubertal years as they're growing and developing through puberty, we'll see that acne development there too. So the hormones themselves will greatly influence the acne presentation on a person as a potential trigger for it. But we also can say, if we kind of circle back and come back to women on that oftentimes women are prescribed birth control, hormonal replacement therapy for acne, and it doesn't work. But then we know that it's not the hormones causing the problem. It's something else in the process there.
That is actually really an interesting point that you bring up. I know I've talked a little bit about the birth control and liver factor before with Dr. Jolene Brighton. Some of you,
Yeah.
I hope many of you listened to that. I believe that was episode 4, and we'll link to that in the show notes on that deeper. But that's actually a really interesting perspective, that if you were on birth control pills and it didn't work, then it means that it's likely not the birth control that was able to actually do it, make a dent in your hormones to help balance what was going on.
Right.
And do you find at all that the hormones may play a role in something like dandruff or some of these other, like psoriasis or eczema, anything like that?
A bit, yeah. We'll look at it and see, check their levels, of course, through blood, and then also through a urine test to look at how they're metabolizing the hormones. So we'll look at those and see. Often what I see in guys and in my female patients and my young kid patients is it's a stress response issue. So is that activation of an overactive stress response or a maladaptive stress syndrome, if we want to get a little more pertinent to how do we want to say the terminology, when that maladaptive stress syndrome occurs, then it can trigger inflammation and trigger other autoimmune reactions, which lead even more to dandruff, for example, or seborrheic dermatitis, eczema, any of those conditions there, acne in that process. We'll see it as a trigger.
And so when you say about this stress response, are we talking about cortisol, or for somebody who's maybe not too familiar with this, obviously like lots of things in life can stress us out. And sometimes people have a very difficult time just dealing with very simple things because they're just overloaded or their system is not able to handle it anymore. In the past, people would call things adrenal fatigue, which we know is not the appropriate way to describe things anymore at all. But how would somebody who's listening to this go, wait, what does that mean? Am I just stressed out? How does that present?
Yeah. I mean, essentially, you nailed it. The really simple lay term is the adrenal fatigue or adrenal insufficiency. And that's a really simple, direct way of describing what's going on is the cortisol response is is either overactive or has got to a point where it's underactive because it's not functioning as well as it should be. So then that person ends up being maladaptive. They can't adapt to a stress response. And a stress response in the system is epinephrine and norepinephrine or epinephrine to cause that fight or flight response. Then cortisol directly follows within milliseconds after that dump of epinephrine in the system to support the fight or flight response. When that cortisol and that fight or flight response becomes overactive, the body adapts incorrectly. And we get a maladaptive stress syndrome. And so then those little things, like you said, you have a strong person, a quote unquote, strong adrenal response, and they can adapt really well. And then you have more of a weak adapter who the slightest little, breeze and they're collapsing because their system cannot handle that stimuli from the stress there. So it's essentially a maladaptive stress syndrome or maladaptive syndrome is what's in the literature itself. Is as you dig deep within medical literature, you can look and see, and it's MAS, maladaptive stress syndrome. But if we really go deeper and that's one of the first ones a few years ago that came out that actually defined it better, that adrenal stress response, that overactive stress response, adrenal fatigue, adrenal insufficiency, because those two terms do not exist in the literature. But the actual response is the same exact thing. If you really go deep, if you go into the sports medicine world and look up overtraining, it's the same exact physiological response. It's overstressing the system and causing that cortisol to be excessively released and then eventually start to not release enough and the body cannot adapt anymore to that stressful stimuli, exercise or life. And it's the same exact physiological response. So when I was teaching this medicine at the University of Western States, that was the process I would go through is okay, guys, do a literature search for, adrenal fatigue and adrenal insufficiency, and it doesn't exist. And I said, now let's go in and look up overtraining. And I mean, gobs and gobs and gobs of tens of thousands of articles for research there that shows that same exact response in athletes that happens in the average person. And so it is essentially that same response, just in the untrained person that's just causing the system to be over responsive to stress.
And I will also point out, too, for those of you who listened to the Eczema and Psoriasis Awareness Week 2018, you also heard one of our speakers talked about the connection between at night when cortisol ends up going high. So you're in a very stressed out state at night, that they've also noticed in some studies that there's an increase in this uncontrollable itching. As a result, unfortunately. Yeah. Have you noticed that in your practice at all, or your work?
Yeah, that, at certain, if that person tends to have more dermatological reactions to things, then that elevated cortisol at night will lead to an immunocomplex increasing, causing antigen antibody to deposit into the skin to make it itch.
So if stress is a piece to this, which clearly it is, and when we say stress, for everybody who's listening, we're not poo-pooing this at all. Like, I know a lot of times you go to the dermatologist and they're like, oh, you're just stressed. We take stress very seriously in this world. So
yes,
what would you recommend to somebody who at night is starting to likely have this pattern where cortisol is going high, they're becoming incredibly itchy, and they're then having trouble sleeping, and they don't know what to do at this point, because obviously sleep is critical. And when this then impacts sleep, it's sort of like this horrible cascade that gets worse and worse and worse. The less you sleep, the more itchy you are, the more stressed out you are, and it just keeps snowballing. Yeah. So what would you suggest to somebody in that boat?
I think, well, one, we have to figure out why it's occurring. But, for a simple symptomatic relief, phosphatidylserine is a phenomenal supplement that's over the counter that you can actually take to lower evening and nighttime cortisol just prior to bed. So it'll calm that itching response down because you're calming the cortisol response in the system. And
that is something where, like, is it something where someone could go to a pharmacy? I'm saying pharmacy as if they're really going to have that. But, they could go and purchase something and use the type of dosages that are recommended on a bottle, or is it more something where you really need to work with a practitioner to understand how to dial that in safely?
To dial it in safely, yes. It's better to work with a practitioner who has the ability to figure out if that's the issue for you. But it's quote unquote generally safe, taken over the counter. You can buy it over the counter and take it. So you can get it that way and try the dosage on the bottle and double the dosage on the bottle if it's not working. But if that doesn't help, you definitely need to get with a practitioner, because you always want to know why and what is occurring there. When you don't know that, then you're just literally, as I always say, you're throwing darts in the dark. You don't know where they're going. So it's better to work with a qualified practitioner, functional medicine doc, chiropractor, naturopath who does these type things, or acupuncturist or a medical physician who has that training in functional medicine to really know what to look for and how to delve into finding that underlying cause of why the skin is reacting the way it is, why you have this autoimmune condition within there, why do you have liver issues within there too, why do you have an overactive stress response? Because we know all those are symptoms, but we have to figure out why they're occurring. Otherwise, we are just practicing what we call allopathic natural medicine, where you're just treating a symptom. You're not finding that underlying root cause and then fixing it.
Yeah. And actually, I have one final, I think, but very valuable question for you. So if we're saying that there's this disruption in the stress response, is it then potentially helpful in getting exposure to sunlight during the day? Not to burn or bake yourself out in the sun if you've got these issues, but do you believe, or have you found in your practice or in research, that being a little bit more in alignment, let's say, with the rising and setting of the sun and getting exposure to that may also be helpful in reset? Because there is a connection between the circadian rhythm and your adrenal response. So do you think that might be something that could also be helpful for people that are just like indoors all the time?
Oh, most definitely. Yeah, there is a ton of research on that, and Robert Zapolsky out of Stanford University is the preeminent guy in the world on circadian rhythms and how it affects globally the hormones, all the hormones and body function, along with brain function too. And if we're inside too much, we need to get outside, get in the sun from sun up to sundown, and we start regulating our body better. We start increasing our amounts of natural production of vitamin D, which is huge. Vitamin D is not just a process it's a pro-hormone for the system. It's antiviral, it's antifungal, it's pro-hormone in the sense of helps you produce better estrogen, testosterone, and progesterone in your system, and DHEA. So getting that sunshine and getting that daily dose there, not like you said, not necessarily burning the skin, we don't want that, but getting exposure to the sun is going to greatly increase that vitamin D, which is globally going to help from the top of your head to the tip of your toes.
Yeah, and I think that's a really important point to make because we've been so afraid. I think many of us have become so fearful of the sun with all of the talk about skin cancer that to some degree, and with our very sedentary lives and work-oriented lives, we tend to stay inside, watch TV, do things within artificial light, and we forget that being outside does serve. It is a part of this bigger, more complex whole that we sort of, in a sense, when your body is saying, hey, I need help, I need you to pay attention to me with all these symptoms, it's this cry for help. I think in one respect, we also have to realize that it's coming back in balance with some of the lifestyle things that might seem annoying at first. And a lot of them are free, by the way.
Yeah. Exactly.
And so it's important to integrate them as best you can into your life. And I appreciate you for just sharing a lot of this because I feel like, if you go to the dermatologist, the only thing they give you is a steroid cream. They don't talk about any of this other stuff. They're not looking at the puzzle from a like 2,000 foot view, saying, okay, what's going on holistically. And I think that that's a really important place to be in. And I know that we've gone across, we've covered a lot of ground here today, but I also think it's important to be able to see that there are other facets to this. And then, and I appreciate you being willing to share and have that conversation as well.
Yeah, we spend way too much time indoors, and it always kind of reminds me we end up looking and being like Gollum from Lord of the Rings, in that sense there is we're just wasting away. We're just imploding on ourselves versus being outside, being vibrant, and getting good air and absorbing good nutrients through good energy through the environment. Getting a little woo-woo there, but that's research has shown that too. The forest bathing, getting out and walking in nature is hugely beneficial for our hormone levels, our cortisol levels, our energy levels, our thyroid levels, our brain function. It shows, research has shown that a ton of times. Just simply getting out in the woods and breathing and walking is epic for our health. And we can't, you brought it up good, is most of the time, 80% of a person's issues, symptoms, whatever else, will dissipate and go away if they correct their environment. We can't out-supplement nor out-drug a bad environment.
That is deep. And that is true. That is so, so true.
We said we were going deep.
I know. We do. You and I both go deep, which is great because they're also going to get to hear our other conversation we had over on the Guy Show.
Exactly. Which was very superficial.
I know. Well, and so for those of you listening and who really can appreciate Dr. Jerry's sense of humor and his approach to things, you have a great website called Lakeside Holistic, where is your practice located? Remind me.
I'm in Coeur d'Alene, Idaho, and Liberty Lake, Washington. We have 2 clinics in 2 states. We have a clinic in each state.
Perfect. And your wife is also a practitioner with you.
Yep.
And our goal is to have her on the show because she's personally dealt with eczema and have her talk about that as well.
Oh, yeah.
And then I've been on the Guy Show. And so for those of you, those guys who are listening, and I would assume ladies would also find the show interesting as well.
Oh, yeah. You want to know more about your guy?
Yes, The Guy Show is a great podcast, and you can check The Guy Show out at theguyshow.net. Dr. Jerry, thank you so much for joining us. I really appreciate it.
Thank you so much for having me on. This was a blast. One of those things is like, how deep do you want to go? Because we can keep digging, but sometimes you have to stop.
Well, until the next time.
Until the next time.
I hope that you enjoyed today's conversation with Dr. Jerry just as much as I have. You can find all of the show notes over at skinterrupt.com/060 and leave any comments or questions there. That way we can both answer them. And I know that I already asked if you would leave a review and rate the podcast, but I'm going to ask you to do one more thing. Share the show with someone whom you know. You can go into Facebook groups, you can go to message boards and share the show, because that is the best way to give hope and allow other people out there who think that all of those pharmaceutical creams are the only option that they have, the opportunity to see that there are other options out there. You can be a catalyst for the change that someone else is so desperately wishing and hoping for. Thank you guys so much for tuning in, and I look forward to seeing you in the next episode.